How do you get your strength and your body back after you've just delivered a baby, right? I mean, you're just waking up at night, the kid is crying, the baby's crying, and you might be having some postpartum blues, and now this baby. So this is what we are going to talk about. Fitness. We are talking about postpartum fitness with Sarah Smith. Sarah has been, there you go. Hi, Sarah. How are you?
Hi, how are you? Thanks for having me.
Absolutely, absolutely. This is a, very interesting topic for a lot of women out there. Postpartum fitness. There you have a small little baby. You're taking care of the baby. Now you got to take care of yourself, and maybe you're having some postpartum blues as well. So everyone, we have Sarah Smith. She has been over 20 years coaching women. Maybe you can tell us a little bit about yourself, and we will go into the topic then.
Okay, awesome. Well, thanks for having me. I started out as an athletic coach. I used to teach and coach high school athletics, like track and field. So I've always had a heart for working with women. I worked with all women then, and I still do. And then I spent a good period of time working in the science world. I have a master's in science, worked at the NIH, the National Cancer Institutes of Health. So I bring a lot of scientific thinking, I think, to my work, even though I work in fitness, which, is, I'm a personal trainer, so it's not like super flashy. But I particularly teach women how to find their strength again after having babies. And so I do a lot of strength training, a lot of lifting of weights, body awareness, breath training. And I love it. It's super fun.
Yeah, no, I think it sounds really amazing. And I was reading on your website that you were diagnosed with something called pelvic organ prolapse. And I don't even know what that means, quite honestly.
Oh, yeah. Well, so you have, and this, some of your listeners, viewers might have this. So within your pelvis, your cavity, you have this is your pelvis, right? This is a female, this is a vulva.
Yeah.
And inside the pelvic cavity, you have your organs, right? You have your bladder in the front, and then your uterus. And then in the back is the rectum. So way in the back. And so what can happen is, because of how you move your body and how you breathe, and I'll add to it the stretchiness that happens in pregnancy, if you're not careful about how you move and you're not smart, which I was not, you can push too hard on your organs and then they can prolapse against the vaginal canal. So the bladder can kind of shift out of place. And so what a lot of women will experience is like a bulging, or they'll see like a pink ball in the vagina and they'll freak out. But the good thing is that I was diagnosed with it, but now I have no symptoms and you can't detect it. So it is something that women can overcome and conquer.
Oh, okay. So in normal pregnancy, let's say, when the women are stretching, obviously, to get the baby out.
Yeah.
So then what happens to the pelvic floor? It doesn't go back in immediately, right? Or there is a little time that it takes to shift everything in place?
It's true. Yeah, our bodies change a lot during pregnancy. The whole alignment changes. You get more of a curve to your spine. Your ribs tend to come up a little bit. And what happens is the pelvic floor has to stretch. We have that hormone called relaxin that allows, our bodies to stretch to accommodate the growing of the baby. And then, of course, when the baby comes out. So, the vagina is actually like pretty amazing in that it actually does come back pretty quickly. It's phenomenal. But what happens that people don't understand is we lose the connection between the muscles of the pelvic floor and our thoracic diaphragm. So there's a muscle at the base of your ribs. And so those two, your thoracic diaphragm and your pelvic floor, they move together when we breathe. But when you're pregnant, what happens is your ribs go out like this, and a lot of times your pelvis dips a little bit. And so these are not communicating as well. So we have a harder time controlling the pelvic floor because we're not breathing like this anymore. We're kind of breathing like this.
Wow. That's, all right. I don't think a lot of listeners know about this, what happens, the shift here. So what should the women do? I mean, what kind of exercise routine? I mean, that's what your expertise is.
Right. So like you were saying, a lot of women, they want to feel normal in their body again. So as soon as possible, they want to get back to exercise, or people are telling them you have to get your body back. You have to retrain. And so they're racing to the gym, but they don't understand. They don't have the good body mechanics for it. So one of the most important things women can do after they've had a baby is to train breathing. And it seems so simple, but as the nourished doc, like I know you appreciate nourishing the body, because when
Yeah.
we're nourishing the body with good food and rest as much as you can when you have a baby, and the breath, it helps to get the tone in the muscles back. It helps everything to start to go back, and we retrain posture again, and we get that connection between the core and the pelvic floor. A lot of women think they need to be kegling and squeezing to get those muscles back, and there is a place for that sometimes, but if you don't train the breath, you're never going to get back to a place where you can really do things without injury, because your body trains the pelvic floor every single time you take a breath. So the best thing you can do is breathe with your diaphragm, not like this, but into your core canister, down into the belly, into the back, and get really good deep breaths. That's a huge game changer. That alone can help people to stop incontinence, having prolapse symptoms, having really tight, painful pelvic floors.
Can you show us a little demo how to?
Yeah, sure.
Yeah.
So I train it all the time. I love doing it. So
Okay.
let's see. So I'm going to come up here. So what I usually do is I try to tell women to put their hands here, because a lot of us have a hard time breathing into the belly,
Yeah.
or breathing into the back. And so I tell everyone to try and sit up kind of straight, or you can do it laying in bed. If you're laying in bed, the baby's napping, get comfortable and breathe. And so what you do is you put your hands there for some feedback. And I like to close one nostril because it really helps us. Many people are in the habit of breathing through their mouth, so we don't even know that we're like, you know, and that sends us into like fight or flight. It makes our nervous system nervous, as you know. So I usually close one nostril and just really calmly breathe, inhale, and then a nice long sighing exhale.
Oh, so get the from the mouth. Get it out from the mouth.
You can exhale the mouth, because the sighing exhale, actually, you'll feel it. If you sigh long enough, you'll feel a little lift in your pelvic floor, and you'll feel a squeezing in your core, your inner core. So when you breathe in, and then nice long, if you exhale all the air out, you'll start to feel it. Sometimes people don't feel it the first few times, but the more you practice it, the better you get. Okay.
And you also talk a lot about the connection of gut, right, with the pelvic floor. So explain us a little bit what happens there.
Yeah, I've yet to meet someone that has pelvic floor issues that doesn't have digestive distress. And I think it's partly like a type A personality. So again, a lot of us live in that really amped state of the nervous system. We're not breathing fully. And when you breathe diaphragmatically, it massages the organs in your gut. If you look at the abdomen, it's like the intestines, the spleen, the liver, the stomach, it's all crammed in there, right?
I know.
And you know, massage is really how we move. You know, we have good blood flow, we have good lymph drainage, we move everything. We actually keep our gut microbiome happy. And so when we're breathing, we massage really well. So a lot of times women that have pelvic floor issues, they have the pelvic floor issues and the gut stuff, and a lot of it is tied again to what their nervous system is doing. There's also the piece that, like, in pregnancy, you know, weird things happen with your digestion, right? You had a baby crammed in there, right? So like a lot of women deal with acid reflux. They eat really maybe like challenging to digest foods right after they have a baby. Like people will be like, I want a burger, I just had a baby. And it's like, okay, but giving birth to a baby is an autoimmune reaction, and it actually makes your gut hyperpermeable. So if you put a lot of stuff in the system right after you've had a baby, you can really challenge the gut and make it almost kind of like injure it a little bit temporarily. And then people get antibiotics when they're delivering, and so that can harm your gut microbiome. So it's not uncommon for women to have gut health issues after they have given birth, and like I said, in conjunction with the pelvic floor because of the nervous system. But if we don't also fix the gut, then if we're dealing with constipation, then we're pushing down on the pelvic floor. And so you can deal with rectal issues because of that. And also, how we make really good tissue to have a healthy pelvic floor is by extracting nutrients from our food. So we need to take care of our digestion and our gut issues while healing the pelvic floor, because they really interact a lot.
Good. Yeah, yeah. So, but so what kind of is it by foods, or is it again by breathing, or is it by
Yeah.
exercise, or all of the
Yeah.
above?
It's all of the above. So I think the biggest rocks I see for women is sleep. I know it's really hard when women have had a baby to get sleep, but these days, like, if it's a choice between getting a 15-minute nap or screen time, take the nap. You know what I mean? Like,
Yeah.
and sleeping as much as you can. There's definitely a food piece, having food that agrees with you, paying attention if, you know, very processed foods or certain kinds of food categories bother you. A lot of people are struggle with like dairy and gluten, you know, and pull those out because they're aggravating your system. Maybe not forever, but for right now. And then breathing. So many of us were just running around and they were just like eating on the go. Taking a moment to breathe diaphragmatically before you eat. And movement is huge because we've seen in the research that movement alone can improve the health of your gut microbiome. So just taking like routine walks, it doesn't have to be hardcore exercise. You can get there when your body's ready. Strength training is great for the gut, but like walking and just moving your body. I use a lot of primal developmental movements like rocking and rolling and crawling, very gentle on the system, which are really good for getting movement in the gut, which is good for the digestion.
Okay. All right. Anything else that you would like to add for all the women who've just delivered a baby and then maybe they're also breastfeeding and now they're waking up and there's too much going on, right?
I know. I could be here all day. But what I'll say is that it takes 10 months, 40 weeks is 10 months to grow a baby. And so people should expect that it will take about 10 months to recover from that process. A lot of things change. Hormones change. We know that. If you're continuing to breastfeed, your body continues to make relaxin so you're going to be a little bit more stretchy. So jumping back into like CrossFit, doing burpees, going for a run might not be the best idea right now while you're still trying to get your body, you know, like I said, there's that your posture changes. So you need to work with a coach or someone smart that's trained and helping you to get back to neutral alignment, have some good breathing. Then you can put a lot of load on the body. But you have time. Rushing back causes problems. It causes digestive issues. It makes you tired. It gives you adrenal fatigue. It causes injury. Give yourself time. It's not forever.
So go slow on the exercises, like simple exercise, simple breathing, like you just said, and even simple exercises to just calm, right? Calm the floor, the pelvic floor there. And take care of your gut with obviously the food, the nutrition, all of those things. Yes,
okay. It's true. It's not the time for like worrying about losing weight. Nourish your body with like really good foods. Nourish your body with good breath. Nourish your body with rest and restorative movement. And I have a free course on if they go to the link in my bio, called Better Than Kegels, and it will teach you how to do that breath. And it's totally free. It's just a digital course because women need to know how to do this. It's the best thing you can do. Like in labor, it also helps with labor because it will relax the system so you don't have to push as much to get the baby out. So
in course, what do you teach in that course? I mean, tell us a little bit about the course.
I basically just bring you through. I have more visualization of the diaphragm, the pelvic floor, and so people understand what they're doing. And then we have some different exercises. We go through breathing exercises and some tips so people can try it themselves. So.
Okay. Well, thank you so much, Sarah. To all the women, I hope you were listening, and if you can tune in after we are done. I see people joining in now. We are almost ready to wrap up. The topic has been postpartum fitness. So Sarah has been saying that go slow, but go strong in the sense, listen to your body, right, Sarah? How would you summarize it? Okay, why don't you summarize what you would like to say to tell people here?
So if you've just had a baby and you're trying to recover, prioritize getting back to breathing and having good body mechanics, good posture. You want your head stacked over your skeleton, and just take your time. Think about nourishing first because strength comes after nourishment. If your body doesn't feel safe, it's never going to feel strong. So focus on nourishing good food, good sleep, good breathing, and then slowly get back to movement. It's advisable for anyone that's had a baby. I would work with a smart strength coach that understands how to work with postpartum women. Even if it's for like a month or two, it will save you headaches and injury in the future.
Okay. Well, thank you so much. Yeah, I see people,
Hey, Suzanne.
clapping.
Suzanne is she's a postpartum expert too, so she gets it.
Oh, wow. Okay. Yeah, this topic is a little bit, I don't think there's that much awareness. People kind of read up here and there, and then start doing something by themselves, and which is not recommended at all. And that's what we are trying to say. To seek help if you've just had a baby. You've gone through so much, and don't feel that, oh my God, overwhelmed, right?
I know. And in traditional Chinese culture and Indian culture, like, they massage women and nourish them with broths and good food, and check their tongue to see if their system is healthy or if they have toxicity for a long time. In America, we're like, get back to work, get back to the gym. And it's just like, no. Like, slow it down. The body needs to mend,
Yeah. Yes. No, Ayurveda talks a lot. Maybe we've had a lot of Ayurveda folks come in here, and they talks a lot about, massaging the baby, of course, but also the same concept that you're talking about, nourishing your body, with the right foods, but also massage part. Massage is very important, right? To get your fluids going here and relaxation. So massage is a big part of a lot of Chinese medicine and Ayurveda medicine, for that matter.
Yes, exactly. I know. There's so much wisdom in that. They know what they're doing, so we should listen to them. Western culture, we're like, we want to expedite everything, make it fast, and it's just like, no, there's time for that. And you know what, this one last thing I want to say, it's never too late. So I work with women that are postpartum, that are in their 50s. You can go back. You can go back and retrain. You can go back and start massaging your abdomen. You can massage your scar tissue. You can start to invest in learning better breathing, learning better body mechanics. It's never too late. Once postpartum, you're always postpartum. So we can always try and do better.
Okay. Well, thank you so much, Sarah.
Thank you so much for having me.
Yeah, absolutely. To all the viewers, please share these sessions, help us. Thank you so much for your support. We are bringing these sessions every single day on different topics, and let us know if there's any other topic you'd like to see. Today's topic was on postpartum fitness. With that, thank you and bye-bye.
Bye. Thank you.